everyone, this is Rita and this is my third video talking about my Chiari. In this video, I will talk about the recovery after my surgery. So I have the surgery earlier in this year. So before the surgery day, I entered the hospital one day before the operation, and I have a lung x-ray checkup, an ECG and blood test on liver and kidney function in order to confirm that my body is normal and able to perform the operation. And before the surgery at the midnight, I have a fasting to prepare for the surgery because the anesthesia will stop all your body those digestion. So fasting is needed in order to prevent any choking or anything complication. So after the surgery, during the surgery, I nearly don't have any memory about it. My last memory will be the doctor ordered me to breathe in some air, and then it should be oxygen with some anesthesia gas, and then I breathed those gas for 4 times, and in the third time I feel numbness in my hand, and in the third time I already lost my consciousness. So the surgery is really fast and I don't know anything about it, and then I was woke up by a nurse, and then she asked me a few questions like, what is my name, do I know where is it, and she asked me to squeeze her hand, left hand and then right hand, and then to raise my left leg and then the right leg. So this is very standard procedure to check your consciousness after the surgery. And then I was transferred to the ICU ward for close monitoring after a craniotomy, and this is also a very standard procedure because after craniotomy, you will be monitored in the ICU for very close checkup on your vital signs in order to prevent or to check if you have any complication and to manage it as fast as possible. And my surgery lasts for about 4 hours at last, and then my day in the ICU is totally like I don't have any memory because I nearly sleep all the day. But I still remember that my family and friends come to visit me for a few times, but it was a very vague and short memory. I only remember I want to vomit and I have nausea, and then I have some paper towel on my body for me to prepare if I have something to vomit out, and also a plastic bag. And then at that time I cannot eat anything or drink anything. I'm on my intravenous fluid to have the saline to directly enter my bloodstream, and still have the scar here. And then I'm also on Foley because I cannot move. I'm restricted, totally bed-bound, and I also using a those airflow bag in order to prevent pressure sore, because prolonged lying may cause pressure sore on your body, which is really troublesome in case if it is developed. Also, I got a very sore throat at that time because the tubing that assists my breathing may cause some injury in my vocal cords and also my throat. And I'm totally extremely tired at that time. I sleep nearly whole day. And then the doctor advised me to eat something like bread or sandwich, those stuff, but I do not really have the appetite to eat those. I only eat some a very small portion of the cupcakes there. And then I also have some difficulties in drinking because, as I mentioned, my throat is seems I cannot swallow the water very good, so I usually choke when I drink it. And my doctor advised me to drink in a cup. It is a very important principle, and I don't know why, but it really made me easier when I drink from a cup. And he also advised me when I drink it, I let the water to stop in my mouth cavity for some time, and then when I prepared, so I will swallow it in one time, swallow all of the water in one time, and then this really helped me assist me in drinking water, but I still choke very frequently at that time. And then I will show you the photo of my wound in the second day. So here is it. And then on the second day, I was discharged from the ICU with the Foley removed, and I can walk freely on my own. But I really have some difficulties to pee the first time when the Foley is removed. So, but it is very normal for every patient who have removed the Foley. And then the doctor also removed the saline, the IVF, because I can already drink and eat well in the second day afternoon. And then, but the stuff, I don't know how to describe it, is still attached here to assist the injection. I have 3 injections at that time. One is for painkiller, and the other is for anti-inflammation. Seems to be some steroid. And then the third one would be some anti-nausea and anti-dizziness injection. So at that time, I have those injections here all go through this vein. So here. And then about my sleeping, I do not dare to sleep on my wound because it is very painful. I'm not very painful, but just you're not very comfortable to sleep on it. So I use a side lying position to sleep, but it also has some problem because when I have slept a very long time, my hip bone is very painful, and also my neck is very stiff. So I would suggest you to constantly change your sleeping posture in order to prevent such complication. And then also for my bed, it is cocked up in my head in order to prevent edema here, no matter in my brain or in my neck. And in fact, because I have a side lying sleeping position, so I have some edema over here in a few days after the surgery. So I will suggest you to move your neck more. I know this is difficult, but just try to increase the range of motion every day and gradually increase it by doing this kind of exercise like this, left, right, and then rotation, and then some side flexion, and then extension and flexion. You will feel very stiff in your wound because of the suture and also the wound pain, but just try to pretend the wound does not exist. Yeah, this is what the nurse told me, but I think it works, and increasing your movement can assist it to heal faster, especially for the muscle. But don't make a very exaggerated movement like suddenly. So this is not good, really. So just try to gradually increase your range of motion gently and slowly, but you can increase the frequency. Yeah. And then I would talk about, the painkiller medication. I think the doctor is very experienced, or I don't know for what reason, the wound is actually not very painful, I will say. So if 1 to 10, maybe the most painful time is only 4 to 5, in my personal opinion. And on the 3rd day, I already stopped the pain killer medication. In fact, this is only Panadol, but I think it is not necessary anymore on the third day. But occasionally I will take it before sleep in order to assist my sleeping and achieving a better sleeping quality. I will say that the environment is that in the hospital is really noisy because the neighboring bed may have some urgent situation like going to toilet or some fever, or the nurse come to check up for her vital signs, blood pressure, etc. So in fact, the hospital environment is noisy and really not good for sleep. So you may need earplugs to assist your sleeping. And then I would talk about some side effect, or I don't know what is that, but the main problem that I encounter after the surgery will be tinnitus, headache, and blurred vision. So for the tinnitus, actually I really don't know why I have it. I still don't know. So it is present before my surgery and still exists after my surgery. And then in some occasion I feel like moving my head or changing the head position cause more tinnitus, but I still don't know why, and I will find out later by seeking doctor advice. And the second one would be headache, and this is very, 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 very common for people who have craniotomy. The kind of headache is like suddenly have some increased pressure in your head and feel like very stiff suddenly, and then feel like there is a stone that is on my head and pushing me down. So this is not a very good experience, but I think it's still tolerable for me. And it actually happens more frequently in the 4 to 5 days after the 4th to 5th day after my surgery. So I don't know if there is some kind of healing or some increased reaction inside my brain that actually healing, but will have some increased metabolism or edema, or those things that causing me to have these kind of sensation. But the doctor mentioned that sometimes the muscle will give you such kind of sensation, and I really don't know. So just listen to my doctor and trust him. And then I also have some neck stiffness, as I mentioned, although I move very often, but usually it's like I try not to move very in a big movement, so my whole neck and also shoulder muscle is kind of like stiff. And then but it all turns better and on day 6. Yeah, I really remember that morning I wake up and feel like my shoulder is not that stiff, my neck is not that stiff, and my wound is like, I nearly forget that it's there. Yeah, it is. It may sound exaggerated, but I really feel like that on that morning, and I remember it hard. So but another point to mention is like I have some low-grade fever on day 5 and day 6, and I don't know why still, but seems it is normal for people who have surgery to have some low-grade fever. But if your fever get more serious, so this will maybe sign of infection. So you have to tell your doctor instantly, so to avoid any further complication. And I discharged from the hospital on day 7. Actually, the doctor advised me to discharge already on day 5, but because I have some low-grade fever on that day, so he decided to keep me until day 7, so I can discharge after I remove the suture line. and then he helped me to remove the strapples, or I don't know what is that, I can't see because and then he just cut some string out. It is totally not painful, and after removal of those string out, my neck become more flexible, like I can move more freely because it is not that stiff at the wound. But also on day 7, my wound start to become itchy, and it is also very normal for a healing, recovering wound to become itchy. For people who have Chiari surgery, I have the following advice. The first one would be move your neck often as if you do not have a wound there. But just as I mentioned, do not move very quickly and have a very large movement. And the second one would be walk more. Since day 3, I already walk like 1 to 2 hours each day. Sometimes you do not have to constantly walking and moving. You can be standing there and do not move, but it can be already helpful to training your stamina and to help you resume your daily life. Also, try to prevent pressure points while sleeping, because I know that it will be very tiring after the surgery, and you will probably be sleeping or lying on the bed or sitting on the bed, and most of the time after the surgery. So please remember to walk more, stand more, or constantly change your sleeping posture to prevent any pressure point on your body. It's really true because it can really affect your sleeping quality if you have those pressure points or even develop pressure sore, which I think is a very low possibility because pressure sore usually only appear on elderly who have some movement restriction. But if you already developed those pressure points like me before, so please remember to change your posture and try not to sit that much or using some cushion to help you divert your weight to other part of your body. Yeah. And also, finally, the final tips is like, because having the surgery in the head make you cannot wash your hair like before. And for me, I didn't wash my hair for 10 days. Actually, I'm very, 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 very unhappy and angry about it, because before I usually wash my hair every day. I like to make my hair clean and not oily. So maybe because I didn't wash my hair for 10 days, a part of my scalp seems to have some inflammation and have some yellowish discharge, which is really awful and disgusting. It is even itchy, and I also check up for the medical advice from doctor, and he just advised me to wash hair as soon as possible. So when I get home, I use a bucket of water to wash my hair like in the front. So it can help you to clean your hair as soon as possible after the surgery. But if you are not possible to do that, at least use a wet towel to try to clean your scalp. It is very important, especially if your hair is those oily type like me. So it is very important to keep your scalp hygiene, or else may develop very serious inflammation like me. I'm very lucky that after applying some cream and eating some anti-allergy medication, the condition is actually improved greatly now. So at least try to clean your scalp with warm water using towel. Just clean the surface of it is okay. So this is the end of my video. Now I'm already on my day 13 after my operation, and I already can live very normally just like before. I can go to street and go shopping for like 3 hours and then go watch a film, etc. But sometimes I still have the tinnitus and some stiffness in my neck. I don't know why, but I think it is still simple and tolerable and also common. So I will wait to see if this problem will go away later. So I also wish everyone good luck, and also for those who are going to have surgery, good luck for your surgery, and remember my tips. I hope this can help you, and sorry for a very long video. Thank you for watching.